Hello, my name's Damon Horn. I'm one of the pharmacists from the EPR team. I'm just going to be going through a quick video today on how to prescribe Warfarin for initiation. So to start off with, we've got a patient here who needs Warfarin prescribing. I'm going to go to Requests and Care Plans and then Add. Warfarin is always prescribed in a plan. So if I type in Warfarin, you can see here we've got a selection of plans to pick from. This one here, the adult plan, I'm going to select first. I'm just going to close this and full screen this to make it a bit easier to see the whole screen. So this patient needs to be initiated on Warfarin. You've got two choices. You've got the initiation or the maintenance one. I'm just going to tick here for initiation. Then we have some information at the top of the plan. This is the same for most plans. There'll be information to read, and this will help you decide on which dose to select. In this case, the patient needs the 5 mg dose here, and this is going to be for 3 days. Ticked against that, and then if you scroll down to the bottom of the plan, you'll see that you also have some bloods that you could order. You might need to do this for baseline measurements. Once you've selected what you need, click on Orders for Signature. Review what you have here, and then click Sign. At this point, we need to complete an oral anticoagulant form, and this gives information to pharmacy and anybody else who might be looking at the record to find out why the patient is on Warfarin. So if you click on Document, have the baseline bloods been done? In this case they haven't, but you should then also order them. Indication for Warfarin. You have a selection here, and in this case it's AF. The risk factors you can select if you know them. Any other relevant information can be completed here. For target INR, if you're uncertain, there's a tab at the side here which gives you more information about what the normal targets are for each indication. In this case, we're going to have a range of 2 to 3 with a target of 2.5. The intended duration of treatment, again, if you're uncertain, go to the tab here and it will give you some guidance. So in this case, it's going to be long term. The patient wasn't admitted on an anticoagulant, and they will need counselling. It's important to then let pharmacy know so they can counsel the patient. Once you're happy with that, sign the form with the green tick, and then that will let you sign Warfarin. Just going to refresh the screen, and I'm going to go to the drug chart to make sure that Warfarin is prescribed. You can see here Warfarin's been prescribed as intended for 3 doses. After this, you will then need to review the bloods and check the INR, and then continue at the next doses that you need.